to read the chart and read the doctor's order if the patient is allowed to have a bath in bed. After that, I'm going to knock the door of the patient's room. Hello, ma'am. Good afternoon. I'm Mrs. Mary Arl Erigbogas Dulu, your caregiver from 3 to 11 p.m. May I know your birthday, ma'am? Your name, ma'am? Then you secretly check the wristband. Okay, ma'am. Ma'am, this afternoon I'm going to bath you on bed so that you will feel fresh, fragrance, so that avoid foul smell and protect you from any microorganism. And also, ma'am, to let you feel relaxed and comfortable. Is it all right, ma'am? Okay, ma'am. Then check the vital signs of the patient, temperature, pulse, respiratory rate, and blood pressure. And after that, you ask permission from the patient. Ma'am, I go back first to the nurse's station to prepare the materials needed. Okay. Then raise the side rails and lock. Go back to the station and check the materials that you need. You bring this to the bedside the patient, of course, and then you do hand washing technique. You put on your PPEs, your mask, gloves, and possible apron. Then go back to the patient's bedside. Provide privacy. And you ask the patient, ma'am, do you want to urinate or defecate so that you will not feel uncomfortable during the procedure? And it will not also disturb our procedure later on. And you don't feel like it. So if the patient would like to defecate or urinate, you have to serve first the bedpan so that your procedure later on will not be disturbed or the patient will not feel uncomfortable. Like there are some patients who feel ashamed when you are working with them. They feel to want to urinate or defecate, and then their bladder will be full. They will be uncomfortable at that moment. Okay, thank you. Then after that, you are going to change the top sheet with bath blanket. The technique in changing the top sheet with bath blanket is this way. See to it that the wrong side of the blanket should be up. It should not touch directly to the patient's body. So what is the purpose of the bath blanket? The purpose of the bath blanket, if the top sheet is still clean, you will not render the top sheet dirty. In other case, if the patient's top sheet is already dirty, if the patient's body is already clean, it will not contaminate the patient's body, which was cleaned already. So you're going to roll this. So in order to save time, you prepare this one while preparing the procedure. And then put this on the patient's neck part. Look for the wrong side. It should be up. Where is it? This one. And then the one end of the bath blanket, if the patient cannot hold it, you just tuck it under his shoulders or her shoulders. And then pull the bath blanket together with the top sheet down, going to the foot part. I did not use gloves. You have to use gloves, or right gloves. Use gloves when working because the okay. If the top sheet is clean, you can just let it hang on the foot part of the patient. If it is already dirty, you roll it very well, and you should practice the proper disposal of soiled linens. Put it inside a hamper. So I just wear the gloves. You have powder there. Para you can see it. So your gloves is yours. It is only clean hand. This is not sterile. It's only a clean glove. So if it's a clean glove, you are going to protect yourself against dirt during the procedure. Thank you.
Useful kayo.
Pag one time, yeah, pag one time. Universal. After changing the top sheet with bath blanket, we're going to remove the what? Soiled gown. So I already provided the patient with privacy. I already served the bedpan to avoid discomfort. And then this time, I'm going to remove the gown of the patient. In changing the patient's gown or removing the patient's gown, you turn patient to lateral position, lateral or sideline position. This arm, like that, and then the other arm should be placed on top of the abdomen. One leg here is straight and the other leg is flexed. Then bend it on the other side. So raise the side rails and lock. Turn patient to the other side. Then remove the ribbon of the gown. Okay, then tuck it away from the patient's back. The other one, just spread it on the other side. Then turn patient back to supine position or backline position. So the position that the patient had a while ago when I removed the ribbon was lateral or sideline position, and this is the supine position or the backline position.
Ay, kasi 6 na ba no?
Then in removing the gown class, you remove first the part and unaffected area. Pasabot,